Hi, my name is Maria Pasimio, and welcome to my presentation for BCIT's Breastfeeding Theory course. This presentation will focus on the breastfeeding challenges involved in a mother with mastitis and an infant with. To explore these challenges, we will utilize the situated clinical decision-making framework. This framework includes knowledge, cues, judgment, decisions, and evaluation. We will begin with mastitis. Mastitis is an infection and inflammation of the breast. This condition can occur at any time, but often within the first 6 weeks of breastfeeding. Common causes of mastitis include inadequate breastfeeding due to engorgement, plugged ducts, or decreased feedings or abrupt weaning. Cracked nipples can also be a cause, as the break in the skin acts as a portal of entry for bacteria. Signs and symptoms of mastitis include influenza-like symptoms such as fever, malaise, and headaches. The breasts appear hot and reddened with localized pain, tenderness, and discomfort. Mastitis can occur in one or both breasts. Mothers with mastitis can still breastfeed, but the breast milk may taste saltier than normal. Next, we will explore the challenges involved with breastfeeding an infant with Down syndrome. Down syndrome is a genetic condition involving the extra genetic material of chromosome 21. People with Down syndrome have different and distinct mental and physical attributes. Here are some of the characteristics involved with a Down syndrome infant. For this presentation, we will be focusing on the infant's decreased muscle tone, protruding tongue, and sleepy attributes. Caring for a mother with mastitis and an infant with Down syndrome can be complex. The priorities for the care of this dyad include 1. Addressing the pain and discomfort of the mother while also treating the infection. Consult with a physician will be required to determine the appropriate antibiotics. 2. Establishing supports and appropriate techniques for the infant in order to achieve a good, effective latch. For this, a consultation with a lactation specialist may be beneficial. 3. Monitor the infant's growth, which identifies whether adequate nutrition is being provided. For instance, is the infant feeding long enough to obtain the hind milk? Treatment of mastitis. Emptying the breast is key. The mother should breastfeed often or express milk frequently to keep milk flowing and prevent further milk stasis, which can worsen the condition. Antibiotics such as doxycycline or cephalexin will be required to clear the infection. Mothers may take analgesia and antipyretics every 4 to 6 hours as needed in order to address pain and fever. Cold or warm compresses may also be used to minimize discomfort. Finally, identifying the cause is vital to prevent further infections from occurring. For instance, perhaps it is the poor latch or the infant's feeding nature that is causing the infection. Babies with Down syndrome are easily tired and often sleepy. Keeping them alert and awake during feeds is important in order to ensure they receive adequate nutrition, especially in regards to obtaining the hind milk. Hind milk is rich in fat and calories, essential for growth. However, this milk is secreted only later in the feed. Here are some tips to keep the infant awake and alert. Infants may need to be woken up for feeds every 2 hours or at least 8 to 12 times a day. The infant's low muscle tone and protruding tongue also poses a challenge to breastfeeding. Often, the infant is too weak to establish a good latch and strong effective sucking motion. Additionally, the tongue also affects the quality of the latch by pushing against the nipple. To address these issues, there are a variety of positions or holds that efficiently support the infant's head, neck, and upper back. These positions include the cross cradle hold, the football hold, and the dancer hand position. The dancer hand position is especially useful in supporting the muscles surrounding the chin and jaw. Initially placing a finger on the infant's tongue can also help move the tongue into position, keeping the infant's tongue down for an effective latch. With interventions established, we now need to determine whether these treatment and strategies are successful in solving the challenges. The desired outcomes we are looking for include decrease in the symptoms of mastitis, indicating the infection is in the process of clearing up. In addition, the cause of the infection is identified and addressed, thus preventing future infections. As for the infant, effective latch is accomplished and adequate intake of milk is recognized by noting appropriate growth patterns and adequate waste output. This concludes the presentation of the breastfeeding challenges involved with mastitis and an infant with Down syndrome. Thank you for your time, and I hope that you enjoyed learning about the ways to support the dyad.